Many Capital Region residents may have had a hard time finding a doctor.
News 10 Zion Decoteau taking a look at the extent of the problem here, what officials have to say about maybe fixing it. Zion.
John and Lydia, I spoke with two experts, both of whom say that a myriad of issues are contributing to the healthcare worker shortage in our area.
There is a shortage across the whole spectrum of providers, plain and simple.
Assemblyperson John McDonald, who is also a pharmacist, says the shortages run deep.
Whether it's the aides in the nursing home, the nurses in the nursing home, in the hospital, the technicians, and yes, in birth centers, and yes, with mostly primary care providers.
Joe Maldonado, the former president of the Medical Society of the State of New York, agrees. He says the problem extends to most of upstate New York. Why is upstate having such trouble filling healthcare worker positions, particularly doctors? He says diversity plays a role.
The large metropolitan regions have very diverse communities, which the rural communities do not have. So in a state that has many physicians from other countries, many of the physicians that come to us from other countries want to be able to have access to communities that are similar to themselves.
Maldonado says because of the lack of physicians, patients are turning to healthcare practitioners, which he says aren't the best substitute because they don't have the same years of training as a specialist. Specialty services require a physician to have 3 years of training, whereas healthcare practitioners do not. He says this doesn't leave patients with the best care.
So take, for example, a surgeon, take a specialty such as urology. That specialty is a 5-year specialty. Plastic surgery, 5 to 6 year specialty. Ear, nose, and throat, again, 4 or 5 years of training. You cannot replace that level of expertise with someone who has not done a residency and who is coming in with a different background.
Dr. Maldonado also says a major reason physicians are attracted to large metropolitan areas is because of cross coverage. A doctor in a large metropolitan area is typically on call less days of the week than in a rural area where a doctor may be on call almost every day of the week. As for solutions, Dr. Maldonado says more residency programs are needed to improve the odds of doctors who train in upstate New York staying here. The doctor also supports programs in which doctors get a portion of their med school loans forgiven by the state for every year that they stay and practice upstate. Live from the studio, Zion Decoteau, News 10 ABC.